A warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation, and here with Charlotte and Boo, and we're here for a very special moment for the Immunization Collaborative. We're going to announce today the first selected participants, and we are going to kick off. Charlotte, how are you doing? How are things going?
Hi, Reda. I'm doing great. I think my connectivity was a bit slow there, but I just want to say hello and warm welcome to everyone that's joining us today for this Immunization Collaborative check-in.
All right, wonderful. And we're going to start. I'd like to go to Dr. Imam Wadabelo with this question. Imam Wadabelo, I hope you're going to be able to unmute. I'd like to ask you the following question. Explain to us, what is this Immunization Collaborative in one sentence? We do this with Teach to Reach. I hope you're able to unmute. Looks like you're not going to be, you're not answering yet. We're going to go to Ahmad Tijani Habibu and Abdullahi Umar, inviting you to join us and explain what is this collaborative in just one sentence. We'll also go to Chinwe Eze. Chinwe Eze, please go ahead and unmute yourself if you'd like to take on this question. It's not an easy one, but especially to make it fit into one sentence. We're looking to our Nigerian scholars, leaders. All right. It looks like we're not getting an answer. If anybody else would like to join to answer, please do raise your hand. We know you as leaders. These meetings are for the very first time open to greater numbers of applicants beyond the initial circle of scholars. All right. We'll keep going. We'll come back to this question. Please do raise your hand if you'd like to answer this. So first of all, a couple of the basics about who is behind this initiative. So this is a Geneva Learning Foundation in support of really the Nigeria movement for Immunization Agenda. We're working together with the National Primary Healthcare Development Agency and UNICEF. And what it's about is very simple. I'm going to ask Charlotte to break it down for you.
So in Nigeria, many children do not receive the vaccines that they need. So we have lots of under-immunized and zero-dose children. And we have about 4 million children that miss out on the vaccines. So as health workers, I think we can do more if we come together to see how we can reduce the number of under-immunized children in Nigeria.
All right, wonderful. And if you see your microphone becoming active, please raise your hand or just go ahead and unmute. We'll go back to that question and hopefully we'll get at least one person who takes on who can explain what is this Immunization Collaborative in just one sentence. Usman Mohammed Tukur, please go ahead. Introduce yourself, tell us what you do and who you are, and then explain what is this Immunization Collaborative.
Hello, everyone.
Yes.
Good morning, good evening, Reda and Charlotte. Thank you so much for giving me this kind of opportunity. My name is Usman Muhammad Tukuru from Kano State, Nigeria. I'm a public health practitioner working with many NGOs in communities in order to get zero-dose children to make sure they are immunized. And immunization collaboration, from my own perspective, is a way that relates all the stakeholders that are concerned in the immunization exercise in order to have harmony exercise from the community down to facilities and down from to the entire beneficiaries who are supposed to receive the immunizations. So if all the stakeholders, all the beneficiaries, all the community structures can come together and work together by joining hands in one way or the other, that they really make immunization collaborations. So we are hoping for every community structures, for every stakeholders that are concerned in immunization to have this harmony immunization collaborative so that we should have a wonderful exercise by the year 2030, so that we should come end of zero dose children, especially in Nigeria. Thank you so much.
Thank you very much indeed. So here we see we've been, for those of you who've been participating in the preceding weeks, you can see that today we are announcing the first batch of selected applicants. The closing deadline is Friday, so if you're watching this, do not delay any further. Requesting the application, beginning the application process is as simple as what I was showing just a second ago. Type in your name, your email. Obviously, don't just type the words, your name, but type your actual name. If you, of course, want to know more, there's a lot more information here that you can we encourage you to take the time to read. Now, for those of you who are going to be accepted in today's first announcement, the key date will kick off on the 15th of July. These dates may be slightly adjusted. I know Charlotte's been working on an updated schedule, but they're roughly over the course of 2 weeks. That is when the main work that you'll be involved with, should you be accepted into the collaborative, be included today. So how do you join the collaborative? This is just a recap. Now, we're going to also announce new organizational partners. So if you are a leader of an organization in Nigeria, you are invited to complete the partnership form, and also we'll be sharing the letter of endorsement, which we'll be asking you to sign, or for your organization's leaders to sign and to disseminate. So again, the closing deadline for what we're calling Cycle 1 is Friday, 5th of July. If you have colleagues who have not yet applied, we really urge you to delay no further. Now, registered for today's launch, 407 health professionals from Nigeria. This is an initiative specifically focused on Nigeria. We're going to fill you in on how many states, which ones, how many LGAs as well in today's session. We're going to go back 2 weeks in time. And on the 17th of June, 23 of you had shared with colleagues. So you've all received, if you're here, if you're watching this, if you've requested the application, you've received this big green button called share with a WhatsApp icon. Now, the one you want to go to first is start your application. And the second one, once you have submitted your own application, is really to invite colleagues to join the first Nigeria Immunization Collaborative. Now, how many had been reached by the 17th of June? You've seen this number before, 29,945. And the process is very simple. Again, by 1st of July, by today, or actually early morning today, 46 of you had shared with your colleagues. I've put Rebecca Bello's name. She's one of the most prolific leaders and sharers. We really appreciate her and the commitment of 45 other colleagues who took the time to share and document their sharing. So really, in addition to just sharing, which we know many more are doing, we're asking you to tell us about it so that we can properly recognize the work that you do. So here is the number as of 1st of July. 15,000 more have been reached, as you have reported to us. So we want to really celebrate this with you today. You can see the names as of 1st of July of all the 46 who've contributed to dissemination, from Anu Rotimi to Zakaria Shehu from Jigawa State Primary Healthcare Development Agency, who shared with 300 people. So if you remember, on the 17th of June, for every 226 reached, one person had expressed interest. And this is based on what you tell us, and nothing more, but nothing less either. And so by the 1st of July, for every 64 reached, one had expressed interest. Now, on 17th of June, 12 organizations had partnered, and this number has now increased, as I'm very pleased to share again that 46 organizations now have one of their staff, one of their members, one of their volunteers who submitted a partnership application. You can see the list here. There are actually now 3 screens of organizations, and you can see some of the logos that have been shared on behalf of partners, by participants, applicants in the Nigeria Collaborative. So we want to thank these organizations. We know for some, such as the World Health Organization, there is a more formal process, but we do want to recognize that some of you who work for WHO have really stepped up and said that you want WHO to be partners. There may be the same issue with other partners as well, but this again is what you have told us. So again, on the 17th of June, 130 had expressed interest, and as of 1st of July today, an additional 567 people have joined us, and 699 have expressed interest in the collaborative so far. So this is where we're going to stop with a question for those of you who are with us in our Zoom studio. Why do you want to join the Nigeria Immunization Collaborative? We're going to try to go to some of you who've been who already have their microphones activated, or and really tell us, why have you taken out? You probably had other things to do at this time at this time of the day on Monday, 1st of July. Why take your time to join this meeting and this collaborative? Of course, we're going to be announcing the names of those who have been formally accepted into the program. So, Charlotte, over to you.
Okay, Rada, we have Usman. Go ahead and unmute. Okay, over to you, Usman Tijani.
Yeah, good afternoon, everyone.
A warm welcome to you. We hear you loud and clear.
Charlotte, can you all hear me? Yeah, exactly. So I am Usman Tijani. I work with My Kings, a US-based organization in collaboration with working in Nigeria in collaboration with the MGF. I work with the national EOC, supporting the national EOC, but sent to Zamfara State to provide technical assistance in the areas of managing immunization data. So why I like, or the reasons why I want to join this, is for the fact that when I was working with USAID in one of the immunization programs, like 10 years ago, I realized that when we had sessions of mentoring and coaching, where we normally come together, build each other's capacity, understand how the game is, everybody is allowed to share his own experience. So we saw successes in that regard. So providing leadership in the areas of collaboration is one of the key aspects that I feel will make people understand why immunization, and at the end of the day, people would like to be immunizing their children. So basically, this is why I want to join this. I believe that if whereby people from different corners, especially in Nigeria, professionals can come together, share their experience, work together, so at the end of the day, we can achieve the success that we wanted to achieve. So that's all. Thank you and over.
Usman Tijani, we're not done with you yet. What is the biggest immunization challenge that you face and in where you work? Can you tell us about that? And then tell us, why haven't you been able to overcome this challenge? There's so much effort and so much talent and so much goodwill and effort and hard work put into immunization in Nigeria, and undoubtedly where you work as well. How do you think the collaborative is going to help you? So really 3 questions that you see on screen. Oh, and I think we lost Usman. Yes, we did. Okay, all right. So these are the questions. Let me see if we can get him to unmute. Otherwise, Charlotte, back to you. I see. Let's see if there are more hands raised. Yes, Ukamaka Okafor would love to hear from you as well.
Ukamaka, please unmute yourself.
Please go ahead.
Great. Over to you, please.
Okay, thank you very much, and good afternoon, everybody. I'm happy to be here. The biggest challenge we face in our work as community pharmacists is that the community pharmacy in Nigeria is not permitted by law to administer vaccines. But a lot of the public come to community pharmacy to seek help or to seek care. And we recommend vaccinations to them, but we don't do vaccination apart from during COVID-19, when there was an emergency and the government recruited a lot of community pharmacies in Abuja in particular and Oyo State to give vaccinations. So and we are not able to overcome that challenge because there is no policy protecting the pharmacists to administer vaccines. So, and I think that the collaborative team can help us because the NPHCDA, who is supposed to give that approval, is in this collaboration. And that is one of the reasons why we are here, so that we can know how we explore utilizing the community pharmacy to reach every eligible person for vaccine in Nigeria. Thank you.
Thank you very much indeed. Now, Egwu Jubilee Igwe says, I have questions. So, Egwu, please go ahead. We'd love to hear your questions as well. That is one of the goals of these Monday check-ins.
Good afternoon, everyone.
We hear you loud and clear.
I'm so happy to be in this Zoom meeting. My name is Egwu Jubilee from Ebonyi State. I'm working together with Nigerian Cross Society. My question is that this immunization campaign is not going to the grassroots here in Ebonyi State particularly, because when they bring the campaign, they always do the campaign serially in urban area. My question is that how can we move this campaign to rural area, to make sure that the people that need it, in a collaboration of what my colleague just said now, is only during that COVID-19 that government exploit people to take the vaccines. And when they exploit people to take their vaccines, they're not taking it generally to the whole local area and also to the communities. That means, that is my question, how are we going to do it and make sure that the vaccines reach to the vulnerable people that needed it only? That means, let me talk about my challenges. Our challenges is that local languages and belief make some of our members, people in the communities, to run away from these vaccines. That means I need campaign supporters, members, maybe from my units, the volunteers of Nigerian Cross Society and other collaborated agencies, the PVC and others, to work hand to hand to make sure to give them in their local languages and also give training very well for them to understand this, because without that, there's no how you bring the vaccine to them. You will be seeing people from the local dialects will be saying you should run around there trying to reduce the population of people in the society. Then it is a very big challenge to us, for us to be able to communicate with these people and for them to take this vaccine. Thank you, sir.
Thank you very much indeed. So I'm not going to answer your question. It is your colleagues who are going to answer your question by sharing your experience with them, and they will share your experience with you. But Egwu, I do have a question for you. Have you applied to join the collaborative? Because it is not only filling in this form, but it is then actually answering all of the questions to identify what challenge you want to take on, what specific goal you have, and what actions you're going to take to achieve that goal. Have you been through this process yet or not?
Yes, I have done.
Okay, all right. So for anyone who has not, you have until this Friday, 5th of July to do so. That will be the first deadline. We may extend depending on the feedback that we get back. Now, we are going to hear from Zara Abubakar. Zara, please go ahead.
Hello, everyone. My name is Mrs. Fatima Zara Abubakar Otaro, and I'm coming definitely from the education perspective.
Yes.
Hello, can you hear me?
Yes, loud and clear. And we discussed in previous weeks, we've heard from you about the truly important aspects around pre-service training and the way you're working with students to help get them ready to do the work of immunization.
Yes, from professional perspective, honestly speaking, youths nowadays are very, very reluctant to engage themselves in this whole immunization process because insecurity, the financial perspective, because everybody now needs money. So it's even quite difficult to encourage youths, as in growing teenagers, to enrolling. They're enrolling in education to push. They're all pursuing their education in the health perspective or in the health career. But this immunization, I registered to learn from other professionals on how I can make it more encouraging and let them become more passionate. Yes, things need to be fixed, things need to be put in place for especially the security perspective, security aspect. But I feel this opportunity will help me learn better ways to be able to encourage them and groom the next generation of health workers that will participate in continue this whole immunization process nationwide and globally, hopefully. Yes, that's just it.
Thank you very much. So, Zara, I think we kind of broached the topic in previous weeks. What we can say is that the collaborative is not for everyone. It is for the most committed, the individuals, the leaders who are ready to go above and beyond. Now, that is not a question of your rank, of your role, of how many diplomas you have. It is a question of your intrinsic motivation, what you have burning within you to want to make things better for children, and their families. What I can tell you is that we have seen in many cases of individuals who, through their participation, experienced very rapid career progression and attribute it to what they learned and how they learned it by participating in initiatives of the Geneva Learning Foundation. Can we guarantee this? Of course not. But what we won't do is offer extrinsic financial incentives, because that will poison the chalice in a way. We would rather have someone not participate than...
No, this is not about the finances. This is not about finance. This is about how am I going to be able to instill the passion in them to know that everything goes beyond finance. Because I am doing this out of my own passion. My institution has gladly has seen the passion I have for this. So they have volunteered me as the 100, or will I say practically 100% member to participate in this. And I am also very, very much interested in learning. But whatever I learn, definitely as a health educator, I'm going to transfer that knowledge to my students. I'm not just going to learn everything and put it in myself, because of what use is learning something and not being able to pass it on to other people to also improve themselves. So that's just what I'm talking about. It's not about the incentive from the organization to give my students. No, obviously not. It's about how I want to learn, mingle with other professionals, learn from them, and see how I can instill the same passion and drive that we all collectively have in Geneva Learning Foundation, and how I can send it on to my students. That's exactly what I was talking about.
That's beautifully said, Zara Abubakar. We look forward to learning with you exactly how we can reach more colleagues who initially may not see the point of joining an initiative like this. Now, we've asked you to share your experience, and we want to already honor a number of the first contributors who have done so. And we asked by email, you, why do you want to join the collaborative? What is the biggest immunization challenge that you face? The same questions we're asking you today. And we do want to honor and thank and recognize the 18 participants, applicants or interested parties who have taken the time already to respond and to share their experience. You can see their names on screen. Now, that's not all, because we want to share with you now some information about who has applied to the collaborative. First of all, we have 33 states represented. And you can see the states represented here. 71 local government areas. You can see that together with the state. So these are people who work at the level of an LGA. We asked you about your top 9 challenges. And so far you can see that reaching zero-dose children in missed communities, 54 people saying this is my top challenge. And similarly, kind of overlaps, adults and children missing their vaccination stats, 52. The disruptions to routine immunization is at 39. You can see the rest of the numbers on screen. Now, right now, 40% of those who applied are women, 60% are men, And you can see that there's what we would call, with Charlotte, a healthy mix of different levels of the health system represented. We have people who work in local communities at the facility level. We have people who work at the LGA level. We have people from state level, and we have people from the federal level. In terms of who the employers are, just over a third work for the government, and the remainder work for NGOs, for education organizations, like we just heard Mrs. Zara Abubakar. Some are currently unemployed. We do also want to recognize that. And then we asked you, with respect to Immunization Agenda 2030, when you identified your challenge, to classify that challenge. And at the top of the what we call key focus areas is immunization in primary healthcare. Interestingly, the second item at the top of the list is leadership, governance, and management. And the third item is vaccine preventable disease surveillance. You can see the remaining 12 items here. So that is to give you an overview of who has applied to date, but the main reason we want to come together today is to actually share with you the first batch of applicants selected as of today, who will be receiving their letter of acceptance to the collaborative. And we're going to go through with Charlotte. We're going to, now there are too many in numbers already to read the individual names, but we are going to show you the list of names, and they'll be showing on your screen. I hope you can see them now. And look, of course, if you have already applied, we hope that you'll see your name. It's in alphabetical order by first name. Here we go. So we want to welcome this very first batch of Nigerian health professionals to the collaborative. So these individuals have gone through the collaborative process. Charlotte, what would you like to say to them about welcoming them to the collaborative today as of July 1st? The application process is still open. They'll be receiving a formal notification, a formal letter, but we wanted to reserve the announcement for this live session today. What would you like to share with them?
First of all, I would like to welcome them to the collaborative rather, and also tell them that now that they are part of the family, now that they are part of the collaborative, they have a responsibility, which is to ensure that their colleagues, their peers, and other health professionals get to join. And so I'd like to invite them to share the invitation, not only to share, but to do follow-up, to ensure that those they share with get to apply, and to support in the spirit of peer learning that characterizes all the Geneva Learning Foundation activities and intervention. That spirit of peer learning and mutual support also supports to ensure that those colleagues go through the process of filling the application form, so that next week we will also be celebrating their admission into the collaborative. Thanks, Reda.
We do want to welcome you today. We'll be sharing, of course, your letter, a formal letter of acceptance in the coming days. And so please check your inbox, make sure you do not miss this email confirming your acceptance into the collaborative. And we want to thank those of you already who have already gone through the application process, and congratulate you for your acceptance into the first Nigeria Immunization Collaborative. Thank you very much indeed, and congratulations. And for those of you who have not applied yet or not received a notification yet, or don't panic if you didn't see your name, as long as you applied, you'll be receiving a formal communication very soon. And again, if you have not applied yet, you go to the Immunization Collaborative page, put in your name and your email and just click on apply. And then from there, everything happens first by email. There is a form to fill up. Thank you, Charlotte, for sharing the link. We have been through several sessions over the last few weeks with you, as we're now entering the period in which we are closing we're bringing the campaign, the first phase of this campaign, to a close with the acceptance of the first applicants. We have several days remaining to receive applications that we'll be reviewing as they come in, as we had announced. We're happy to take any questions that you or others may have at this point, and we're happy to hear more. I know that there are more people with hands raised. I see Shatima, Bukar, Abdul Kader. So now that we have congratulated those of you who've been accepted to the first collaborative, Shatima, if you're still there, would love to hear from you. All right. Or if there are others who have questions, I see Abu Bakr Hamza, who also has a question. Otherwise, we thought we would keep this session short, as we're all going to be focused now on launching the collaborative with these selected applicants. Abu Bakr Hamza, we've recognized those of you who shared your experience, those of you who contributed to dissemination, those of you whose organizations have requested to become partners of the collaborative. And I see Usman Mohammed Tukur, the floor is yours. What would you like to share with fellow members of the collaborative?
For giving me this opportunity. I wanted to respond a little bit based on my colleague from Ebonyi State said concerning issue of rural area, lack of vaccine and other things. Yes. I wanted to ask him about, did he follow the right channel for communication from the LGA level down to the state level down to the national level by sending a complaint that so settlement or so communities, they are not receiving vaccine? There's a channel, there's a proper channel mechanism that you can channel the issue, that go to the LGA. If the issue passes the power of LGA, the LGA can channel it to state level. If the state level cannot handle it, also they can channel it to the national level. So I want him, if he can start doing such kind of things before even from the national level or from the other partners that are supporting immunization to come and look for such kind of community. This is part of the collaboratives. This is part of our work to identify such kind of communities so that we should give quick intervention that bring right solution at the right time. So I'm advising him to do this kind of things so that we can have a harmony environment, that he can salvage such kind of community from such kind of issue. Thank you so much, Reda.
Thank you, Usman. And that is precisely the kind of dialogue that you may have with him, not today, but during the collaborative. Usman, I just want to check with you. Have you already applied to the collaborative? You know the deadline is Friday.
Actually, I am going to apply because now I am on transit. So I don't have real time to sit down and apply, but I'm going to apply maybe tomorrow or next tomorrow. I will apply before the deadline.
All right, wonderful, Usman. You have until
I'm
Friday
on transit,
to do so.
actually, yeah.
It sounds like you have a lot of experience to share, and there is a selection process which takes a little bit of time, and the deadline is coming up very soon. So it sounds like you have a lot of experience to share, and members of the collaborative would stand to gain a lot from you. And because you have participated in these meetings, you know that if you submit your application, you will receive your letter of acceptance, but you still have to submit your letter of application. Then of course we do check that it's in, let's say that it's it's a useful application. We've received a few where people put in like yes to all the questions, things like that. So Usman, thank you very much indeed. Ukamakar.
Okay, thank you so much, Reda. It's my pleasure.
Wonderful. We look forward to your participation. Ukamakai, we've heard you. We heard you and the specific challenge. What would you like to share now?
Hello.
Yes.
Hello.
Please go ahead to introduce yourself.
I think I have the floor. My name is Wale Oladipo, National Chairman for the Association of Community Pharmacists of Nigeria. I would just like to say we are glad to be here and we are ready to always collaborate on this. Just to put it on table that during COVID-19, community pharmacies vaccine administer up to 76,000 doses of COVID-19 vaccine.
Yep.
Aside from that, we have not had movements with MPACDA on immunization. And so whatever things that needs to be done, whatever learning we need to do to get over 6,500 community pharmacies accepted into this program, we are ready to do it, including voluntary and free services. Thank you so much.
Thank you very much indeed. There are, of course, a number of participants who have already been accepted into the collaborative who work for NPHCDA at different levels. And by joining the collaborative, of course, you will have occasions to engage with them on a range of issues, including your own challenge, which we heard indeed from your colleague Ukamaka Okafor, and we're very grateful for your participation of you and the other organizational leaders, organizational partners of the collaborative. So thank you. So let's see, we have a number of hands raised. I'm going to go to, yes. And so we were thinking that we could end early, but we do want to make sure that all your questions and comments are answered before we close. So I believe we have Rabiu Abdul Wahab, and then there was at least one other person who had a hand raised. Go ahead, Rabiu.
Okay, thank you, Mr. Reda, for giving me the opportunity to contribute. Please, I would like to call upon to the other colleague from Ebonyi that actually, I remember in April, we had such kind of issue in Bauchi State here in Nigeria we discovered during the M&E TWG meeting that there is some of the commodities of vaccine that has been returned from one of the LGA to the state cold store. So when we had that, we developed a high delegate committee from the states, which include the SIO, IC, and other stakeholders, and deploy to that LGA. So using that mechanism, we ensure that all the HPV vaccine has been accepted in that community. So, and with the existing structure at the LGA level, we have been enter all those communities that rejected the HPV vaccine, and at the end of the day, it has been accepted. So I would like to advise my Ebonyi colleague to go back to the Primary Healthcare Development Agency, or both in the Ebonyi, and some key stakeholders at the Ministry of Health, and use the existing structure in the LGA or in that communities that have been identified. And I'm very sure with that vaccine will be deployed. Even if there is a logistic issue, it can be resolved and that community will accept the vaccine. I'm very sure with that experience as a learning lesson. Thank you so much.
Thank you, Rabiu. It sounds to me like the collaborative has already started through the responses to this particular challenge. Thank you, Rabiu Abdul Wahad. I know you are full-time staff at the Ministry of Health in Bauchi State. So I hope one of the things we hope is that through the connections that you make, no matter who you are in the system, you'll be able to connect directly with fellow participants, fellow members of the collaborative, and while mindful and respectful of certain rules of engagement, we certainly hope that these types of exchanges will, in fact, lead to positive, constructive dialogue and change. So thank you very much indeed.
The door is always open.
Thank you very much indeed. Now we have Abubakar Hamza, who has also requested to speak. Abubakar Hamza, please go ahead.
And rather, while we are waiting on Abubakar Hamza, there is a comment from
yes.
Boyega Alessi, that I wanted to highlight and maybe respond to?
Yeah, let's put that on screen. So thank you for sharing that. So there is, yes, indeed, the best way to complete the application is to start and finish the application in one sitting. However, in principle, you should be able to go back to the application and find your previous responses, even if you did not submit. This depends on your computer your browser's ability to save what are called cookies. Without getting into the technical details, you should be able to do it. It does not work for some people. There are also other issues. I know Charlotte was working with somebody who was facing a problem. Maybe you can talk about that, or any other feedback you may have, any tips as well.
Okay, thanks, Reda. Just from my personal experience using the Chrome browser, I've been able to start filling forms in the past and then coming back later on, as long as I didn't maybe close or change browsers. So it's like if I click back on the link, it brings me to the beginning of the form. And once I've typed in my email address, I notice that all of the previously entered responses automatically are regenerated. So that's my experience. But for those from what I heard the other day from a participant talking about not being able to load the page or having difficulties with filling the form, usually you can just refresh your browser, and then it should work if you are certain that you are not having connectivity issues. So yeah, those were some of the tips. But ideally, if you should start the application, and 15 to 20 minutes, you should be able to finish with it, and that's the best way forward. No, it will not time out.
No, that's correct. Yeah.
And as Reda said, it's really dependent on your browser, maybe your computer version. No, yeah.
And let us know if you have problems. I'm really glad you came to this session when we're able to share this, because we very much want to support you, and we'll be there every step of the way. As long as you do your part, we will do everything we can to do ours. We cannot do it for you, though. That's the only thing. Anifat Egunjobi would love to hear from you, or Promise Onaibe, you both have microphones unmuted. Please go ahead.
Good day. Thank you. Hello. Hope you are hearing me.
Yes, Anifat, we hear you.
Good day, everyone. Good day, Reda and Charlotte. So it's a privilege for me to talk this afternoon. I want to talk about the vaccine collaborative. And in my place, there are some rural area that's very, very difficult to reach. And in my working place, we used to get a bus to reach them. But this bus cannot, because not only the community health department that is using that bus, so there are some other departments that are also using that bus. So we find it difficult to reach. Likewise, those living in that area, they find it difficult to come down to our facilities for their vaccinations. So, and this has become most challenging for us.
Understood, Anifat. And this is the kind of challenge that you'll be able to share and work on in the collaborative. Anifat, can you confirm that you have indeed what you saw your name amongst those accepted in the first batch? This is not the last batch, but of the collaborative. Oh, Anifat, we've lost Anifat. Promise Onaibe, would you like to go ahead? And I just checked, and as far as I can tell, Anifat unfortunately has not yet applied to join the collaborative. So again, if you are making the effort to join these Monday calls, do follow through, and if you let us know if you have any technical problems. Promise, we'd love to hear from you. I'm also checking to see if there are other raised hands that are not, let's say, shall we say, leftovers, asking you to unmute. Adamu Galadima. and perhaps you'll be our last speaker, as we have for those of you who are part of Teach to Reach, we have a Teach to Reach session coming soon. But Adamu, a warm welcome to you. What's on your mind, and what's your question or comment or feedback?
Yeah, so in fact, good afternoon or good morning, wherever you are. In fact, it is very interesting and it's very welcome idea. That is why I'm committed in order to contribute my quota to be among as an academician. The academics, they are part and parcel of all this game, and they can be able to effectively contribute. The first things into this immunization agenda is awareness. You just have to make people to be aware of what is all about the importance, and also the importance of the collaboration and the importance of immunization. So in this kind of collaboration is supporting very investigation. So we would like to emphasize, I would like to emphasize on engagement, which significantly enhance on the community health outcome through education and also nebulization. An effort will include the training of the nurses, students towards the vaccination protocol and ways in which they can be able to reach out to those that are not being able to be vaccinated. So in this, it will increase a kind of a very positive outcome, like increased awareness and engagement from the participant and deeper understanding of the importance of immunization, and also enhance capacity, collaborative partnership, and also policy influence, which are be able to measure the impact in which end of any event and action can be planned and can be effectively being implemented. So therefore, this collaboration, I think we developed a kind of an action plan. I can remember during 2022-23. So in the vaccine hesitancy that we discovered during the COVID-19 pandemic. So there are many people that have a kind of a negative impact towards vaccines. So therefore, we have been able to reach out to them according to our own feedback. We have reached people after that kind of an awareness and also sensitization. So we look forward in order to contribute towards the effective plan and implementation to increase the number of vaccination in our area.
Thank you very much, Adamu. And indeed, we've heard from Zara as well, who also works for an education organization. We value your contribution. There may be challenges in terms of what your action plan looks like compared, maybe different from what it looks like for others who are really involved in delivering immunization, delivering vaccines. But we welcome your participation and your knowledge, what you know, as well as the connection to pre-service training, getting health workers, health professionals ready before they enter the workforce is critical. Promise Onaibe, looks like you're now unmuted. Are you able to speak to us? All right, it sounds like Promise unfortunately has connectivity problems. I can tell you that once the collaborative gets started, there will be 2 sessions, which if you miss them, we will be very sad because those sessions are all about sharing, but they require everyone involved to have a good enough connection to be able to speak. So to speak and to hear what is said. And again, we are sensitive to and appreciate the difficulties of network issues such as those underlined by Sanusi Mohammed. But look at how far we have come. We gave you some very specific data, and we'll be sharing the slides from between 17th of June and 1st of July. And this is the effort that you have made to support your colleagues and to build the collaborative together. So this is very much what we're looking forward to. But it is, even if you have contributed in different ways, we still need you to request the application. And if we're going to ask you once again, for the benefit of your colleagues, to actually share to use the magic WhatsApp link. And I'm going to show you what happens when you click on the link I've just pasted into the chat. This is a secure link, and it will allow you to share the invitation to the collaborative with others on WhatsApp. You choose, of course, who you connect with. The other thing I was hoping to show was, let me see if I can go, so please, if you have not done this, please do it now. And even if you have already shared with your networks, there's now 4 days until the final deadline. So I would encourage you to share as soon as you can again, but this time put a personal message. So it's not just a generic message people can recognize, you just copied and pasted something, but show that you care and show that this is important to you by adding a personal message. So I just want to show let's see, one message that if you are on LinkedIn is likely to be of interest to you. And again, this is a testament to the effort and the energy you have put into the campaign. So I'm trying to show the article here, and this is on LinkedIn. And this is actually an article published by Gavi, the Vaccine Alliance, about the work that those of you who are here with us in the Zoom studio who've contributed to the campaign are doing. So you can go, what I would like to ask you to do is to go to this page, the link that I just shared in the, just in case you can't see it, so it's in the chat. You can actually click on it, you should be able to do that. And as you know, we would like to ask you to do 3 things. The first is to like, but that is actually the least important. The second is to repost. So you just repost like this. And then the third thing, and this is actually the most important step, is to add a comment. So my comment is going to be, it takes a few minutes. If you don't have the time, that's fine. You can hope there are others to do it. But if everyone says that, then there would be no one currently in the collaborative. So thank you to those of you who have taken the time to see this collaborative launched by Nigerian health leaders. So that will be my comment. And now I also encourage you, in case if you have not, to go and look at the Gavi article and share that as well via WhatsApp. There may be some people who've never heard, of course, of the Geneva Learning Foundation in Nigeria, and that's fair enough. But if they work in immunization, they have probably heard of Gavi, and they definitely have heard of NPHCDA. So this article gives you and us some additional credibility that this is what we are, to explain what this is about, and it includes some of the quotes from you as well. So I believe, Charlotte, that is it for today. Let's see, let me just go and check. I'm going to reload this article to see if anyone has actually done it. And of course, it is up to, okay, wow, okay. I see now 3 reposts and a whole lot of comments. So definitely want to offer a round of applause to Dr. Busayo Akomolafe Kayode, who just reshared. Let me just see if I can find all of the names. Rebecca Bello, Charlotte, of course, Yusuf Saleh, Jubilee Tochukwu, Dr. Busayo, and Sylvia. Rami Androsa, who I believe is from Madagascar, but is sharing for her Nigerian colleagues. Thank you very much indeed. This is how we get the word out in today's world. If you have other ideas on how best to get the word out, please let us know. We'll support you. There's, of course, a letter of endorsement we're going to share with you. And just to clarify, what we announced today is the first batch of accepted applicants. Applications are still open. And if you have not shared yet, please do so as soon as you can. Once again, thank you. And Charlotte, let me know if I have forgotten anything. We look forward to kicking off the collaborative.
Exactly, Reda. And just to say, in 7 minutes, we are going to be revisiting Teach to Reach again.
That's right.
And we are looking forward to having you there with us.
All right, thank you, Charlotte. Yes, you should all have received the link if you're guests of honor or partners at Teach to Reach. Thank you, and goodbye.